Okay guys, we're gonna keep going with our PNF principles. We've talked about some of the basic principles. Let's show them in action. So we're on A, restoring mobility. This is for a patient who's having a hard time moving on their own. So one of the most useful techniques is called rhythmic rotation, and it's just what it sounds like. We're gonna do a nice, slow and steady rhythm, and we're gonna take the body or the body part through some rotational movements. These are great for breaking up tone and for helping a patient relax. They're also great as a precursor to any movement that's going to require the patient to rotate, like rolling over in bed. Okay, so this is usually done passively. So my patient, maybe if they have lots of high tone, they're going into extensor or flexor tone. Doing this lower trunk rotation, when I rotate the center of the trunk, what you see is relaxation throughout the whole body. Okay, so my patient's just going to be nice and relaxed, okay? And key is to move slowly. Okay, and she's just going to let me do all the work. It's kind of like you're rocking a baby to sleep. Okay, as the patient relaxes, you'll find that you'll be able to go further and further into the range. Don't force it, because if you force it, they'll just tighten up and fight against you with their tone. Okay, her hand I think is going to be in her way in a second. Okay, watch your body mechanics. And I'm just kind of stepping forward and back into the table. Okay, rhythm is kind of like you're rocking a baby to sleep. Just back and forth. Okay, I could certainly do this with other body parts. I'm going to put this leg down. Okay, I'm going to actually hold you like this. I could do this with just the ankle. Again, it's passive, it's slow. What you'll find as you work with the patient is they will follow your breathing. So if I am nice and relaxed and I use a nice calm tone to my voice and I control my breathing, you'll find that they kind of follow that. Okay, so that is just rhythmic rotation. Again, lower trunk rotation is probably one of the ones that you'll see most often. Okay, from there we can go into rhythmic initiation. This is when we're trying to get the patient to initiate movement on their own, and we're still using nice rhythmic motions. So we would actually start passively. Okay, so this is a patient that at this exact moment can't move on their own or is very limited in their movement. And I would start passively just to kind of normalize their tone. Okay, loosen up the soft tissues. Okay, and then I would tell my patient, can you help me do this? Just help me a little bit. Good job. And I'm going to let them kick in a little bit. So now we went from passive to active assisted. Okay, good. I'm still helping her, but I feel her helping me. We stay here as long as she still needs help with active movement. Okay, but when I feel that she's getting the hang of it, and this could be later in this session, this could be a week from now. Okay, I'm like, okay, you do it on your own. Good, all the way over here, good, and then all the way over here. Good job. Okay, I might still give some feedback, some tactile cues, but now she's doing active motion. You are doing great. Okay, again, we could do any body part with this. Okay, we could be doing shoulder, we could be doing neck. Okay, but we're usually doing a rotational movement when we do this, but it doesn't have to be. You could just be doing flexion and extension of the shoulder if that's what your goal was. Okay, after active, what comes next? Resisted. Okay, I want you to push towards me, both your knees over here. Push, 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 push. Good, now come back this way. Push, push both legs. Push, 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 push. Okay, and she's only pushing with one leg, so I'm gonna give my resistance like this. Push with both. Doesn't take a lot of force. Come on, push, 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 push. Good, push the other way. Push both. There you go. Working those obliques. Good job, push back. Okay, so we went from passive to active assisted to active to resisted whenever they're ready for it, okay? But that's the way we progress through that. Okay, we're gonna do some stretching techniques. Okay, hold, relax. So the easiest example, and I'm just gonna keep using a tight hamstring as our example the whole way through each one of these, because that'll make it a little bit easier. Okay, so hold, relax. What you'll see here is we're going to isometrically contract the antagonist, and then we're going to, on the release, get the motion. Now, the weird thing when we're talking about PNF is the antagonist is the muscle that's against the motion. So here it's our hamstring. So what I'm going to ask my patient to do is try to use her hamstring, use the tight muscle, push down into my shoulder, try to put your legs straight down on the table. 3, 4, 5, 6, relax. And then I would take up the slack. And again, push down. 1, 2, 3, 4, 5, 6, and relax. And then I take up the slack, okay? So she's isometrically holding the tight muscle, and then when she relaxes it, I move further into the range. That is hold, relax. The next one is contract, relax. This one, you really don't use a lot unless someone has pretty good range of motion. So this is about getting the very, very tail end of motion. So here you are going to put the patient at end range, okay? So all the way up here, okay? Try to put your leg all the way down on the table, and I let her do it concentrically, and now move back up here actively, okay? Push down, push down, push down, push down, push down, and then come up. Okay, and I help them go just a little bit further, but they're active on both ends, okay? That is contract, relax. The next one is hold, relax, active movement. It's just like hold, relax, but then we add something to it, okay? So hold, isometric hold, relax, she's moving actively. So here it goes. Push down like you're trying to put your legs straight down on the table. That's the hold, 6 seconds at least. Okay, and when you relax, I want you to kick your leg up. Kick it up. There you go. Well, hello. Okay, push down again. Hold, 2, 3, 4, 5, 6, up towards your nose. Yeah, she doesn't need any stretching. Okay, so that, those are the 3 different techniques to regain mobility if we need to stretch. Go ahead and sit up real quick for me. Just a couple more things. I'm gonna have you swing your legs over here so you're sitting like in a chair. Okay. If we need stability, remember stability is all about co-contraction. So if my patient was not able to sit independently because they were all wobbly in their trunk, and I want to start working on their control of their trunk, okay? And again, I can do this at any body part. I'll show you some examples in a second, but this is one of the more common ones that we do. Patient's feet would be on the floor. Here, let me see. They're almost. That works. Okay, so first one is alternating isometrics. So what I'm gonna do is I'm gonna pull back, and I just want you to stay sitting up nice and tall. So pull against me. 3, 4, 5, 6. And then I immediately go to pushing forward. You push back against me. 3, 4, 5, 6. Yeah, I just wanted to do that. You never do that. And you saw what she did. I like to not. I like to scare her. Okay, you have to let off slowly. That was just fun. I'm sorry. Okay, push against me. I won't do that anymore. Push against me. 1, 2, 3, 4, 5, 6, and then let off nice and slow. Now push back. I'm not gonna do it, sweetie. 1, 2, 3, 4. If I had warned you, it wouldn't have worked as well. Okay, and relax. I didn't have to tell her. She can just feel that I stop pushing and she will automatically relax. That's alternating isometrics, okay? I could do the same thing at the shoulder. Just bring your arm up. Push your arm down for me. 4, 5, 6. And now we're going to push up. Push up. Right there. Yep, just like that. 6. Okay, and I could do that, and that would be for shoulder stability. Okay, we can do any body part. The next one is rhythmic stabilization. If those of you in clinic have probably seen rhythmic stabilization. Can you lay down for 1 second, sweetie? Yep, that's fine. Rhythmic stabilization, hold your arm right there. Okay, make a fist, kind of pick a spot on the ceiling and don't let me move it. Okay. And you've probably seen people doing this and calling it rhythmic stabilization. What they're actually doing is alternating isometrics. Okay, because I'm pushing in one direction then the other. Go ahead and sit up again. Okay. Rhythmic stabilization requires a rotational component. Okay, so I'm going to put one hand on the front of her trunk and one hand on the back. Okay, don't let me twist you. Try to stay up nice and straight. 4, 5, 6. Good. And we'll go the other way. Don't let me twist you. 1, 2, 3, 4, 5, 6. Good. Okay. We're getting stability for a rotational force. Again, I could do that at her shoulder. We're going to put your arm out just like this. Okay. And now don't let me, try to keep your arm right where it is. Don't let me push it down. Now don't let me push it up. Okay, I can do rotation at any body part that rotates. Okay, I could have done it with her arm down here. I could do at her hip. I could do her wrist or her ankle. I could do her neck. Here we're doing her spine. Okay, again, one of the most common areas we treat is the trunk because it's so important. Now I don't have to do these just in sitting. Okay, we could do them in other positions. Put your head down here, but lay on your back. Just like this. And bend your knees. Okay. Now what I want you to do is I want you to bring your bottom up. Now don't let me twist your hips. Try to stay nice and steady. Okay. So I can give rotation there. Okay. So go ahead and get up on your hands and knees on the table. Okay. Have your head down this way. Okay, so I can do alternating isometrics. Get up on your hands and knees like a puppy dog. Okay. Okay, don't let me pull you back. Don't let me push you forward. Okay, that's alternating isometrics. Okay, stay like that, like a puppy dog. I'm gonna get up on the table with you, okay? What if I do this? Don't let me twist you. Don't let me twist you. Okay, you can do these in standing. Can you stand for me?
What way?
Over there. Okay, or actually stay seated right here. Okay, go ahead and stand up. Go ahead and stand up. I won't push that hard. We have to work on strength here a little bit. Okay, now sit down nice and easy. Stand up. Sit down nice and easy. Okay, I could have put my hands kind of at her butt and lifted, alternating isometrics. Go ahead and stand up on the floor.
Stand up on the floor.
Okay, and again, don't let me twist you. Nice. This is going to be really good for preparing someone to walk. Don't let me twist you. Nice, because they need control of that rotation for swinging their arms and taking steps. Okay, have a seat. We got just a few more things to go through. And these are your advanced techniques. Go ahead, head down here on your back. So first one is adding a quick stretch. This is a facilitatory technique. So let's go back to this rhythmic initiation. Okay, so maybe I've been doing passively. Your arms are so long. Okay, and I want her to start helping me active assisted. When I get to end range, hang on, I can do a little quick stretch. Okay, when we get that message through the spindles, they make muscles contract. Okay, if Golgi tendon organs feel tension, it shuts down the muscle. But when spindles feel a quick stretch, their reflex is to contract. Okay, so if I add a quick stretch, it would help her muscles kick in for the return. Okay, quick stretch, come back this way, and go that way, and go this way, and it's just about the timing. Okay, so that's a quick stretch. And I started just show you slow reversals. Let's keep it up with the bridge. Okay, slow reversals would be bridge up, and come down, bridge up, and come down. Okay, where I'm resisting both sides. I can do slow reversal holds, which is lift up. Now hold it there. Now come down. Okay, where I hold at the end range. And then I can have antagonistic reversals, which is basically concentric and eccentric. So I want you to lift up. And now go down slow. Whoa. I'm still pushing. Let's try it again. Okay, push up. Now go down slow. Good. Push up. Go down slow. So this one's nice because your hands never move. It's one of my favorites because it works her really hard, and I get to take a little rest because I don't have to do much. Okay, that's about it.